Let's take a deeper look into sinus osteitis, a condition resulting from chronic inflammation of the sinus bone, often linked to prolonged sinus infections. For medical students, it's important to grasp both the molecular mechanisms and the clinical approach to managing this disease. Sinus osteitis usually begins with chronic sinusitis, where persistent bacterial or fungal infections lead to prolonged inflammation in the sinus mucosa. Over time, this inflammation spreads deeper into the bone. So, how does this happen at the molecular level? The immune system responds to these infections by releasing pro-inflammatory cytokines, proteins like IL-1, IL-6, TNF-alpha, and IL-17. These cytokines call on the immune system to fight the infection, but they also increase the activity of cells that impact the bone, osteoclasts. Osteoclasts are the cells responsible for breaking down bone tissue. Under normal conditions, they work alongside osteoblasts, which are the cells that build bone. But in cases of chronic inflammation, osteoclasts are overstimulated, leading to bone resorption, a process where the bone is broken down faster than it can be rebuilt. This is how we see either bone loss or bone thickening, known as sclerosis, in patients with sinus osteitis. While the osteoclasts are hard at work breaking down the bone, the osteoblasts try to repair the damage, but they can't keep up. The balance is lost. Another key factor in chronic sinusitis, and by extension, sinus osteitis, is the formation of biofilms. These are clusters of bacteria that form a protective barrier, making them much harder to eliminate with antibiotics. The biofilms keep the infection going, which perpetuates the inflammation and bone changes. We assess the severity of sinus osteitis primarily through CT scans. Grading the condition can help us determine the extent of bone involvement. In mild cases, you'll see subtle thickening of the bone. As the condition progresses to moderate stages, bone thickening becomes more pronounced. In severe cases, we may even see bone erosion, where the osteoclast activity has dominated for so long that parts of the bone have been resorbed entirely. In the clinical setting, treating sinus osteitis involves a multi-step approach. We start with medical management. Antibiotics are used to target bacterial infections, although their effectiveness can be limited by biofilms. Corticosteroids play a critical role in reducing inflammation, both in the sinus lining and the bone itself. Nasal saline irrigation helps to flush out irritants and reduce inflammation locally. And in some cases, antibiofilm therapies are necessary to disrupt the protective matrix around bacterial colonies. For more severe cases where medical management isn't enough, we turn to surgical interventions. One common procedure is functional endoscopic sinus surgery, or FESS, where the surgeon removes damaged or thickened bone to improve sinus drainage. In severe osteitis, surgeons might even need to debride or remove areas of bone that have been extensively damaged. Another option for less severe cases is balloon sinuplasty, where the sinus openings are widened without bone removal to help restore normal drainage. There's also a promising new field of treatments involving biologics like monoclonal antibodies. These biologics target specific cytokines such as IL-4 and IL-13, which play a role in both sinusitis and the associated bone inflammation. For patients with chronic sinusitis that doesn't respond to traditional treatments, these biologics offer a new avenue for controlling inflammation and slowing the progression of osteitis. To summarize, chronic inflammation from sinus infections leads to the release of cytokines that drive osteoclast activity, breaking down bone. The balance between bone resorption and formation is disrupted, leading to either bone loss or thickening. Treatment begins with antibiotics, steroids, and nasal irrigation, but advanced cases may require surgery or biologics. Understanding this balance between inflammation and bone remodeling is crucial in managing sinus osteitis. For medical students, recognizing the connection between chronic sinus infections and bone damage helps to ensure that treatment addresses both the infection and its long-term effects on bone structure.